Thank you. I'm going to read this notice again. St. Lawrence County will hold a public hearing on Monday, July 17th at 5:20 p.m. in the Board of Legislators chamber in Canton for the purpose of hearing public comment on the county's soon-to-be-finished community development block grant project, which we call CHIRP 4, or Rewrite Housing Rehab Program, round number 4. The grant award was for $615,000. The CDBG program is administered by the New York State Office of Community Renewal and provides resources to eligible governments for housing, economic development, public facilities, public infrastructure, and planning activities, with the principal purpose of benefiting low and moderate income persons. This hearing is being conducted pursuant to Section 570.486, Subpart 1 of the CFR, and in compliance with the requirements of the Housing and Community Development Act of 1974 as amended. This hearing will provide information about the progress of the ongoing CDBG project. Comments related to the effectiveness of the administration of the project will also be received at this time. And again, written comments may be submitted to Jason Potenauer at the planning office or by email to him until Friday, July 28th. So this is the second public hearing for this grant. The first public hearing was held during the application period, and the second public hearing is required to be held when the grant is approximately 80% complete. The deadline for this grant is December the 8th, and we are almost at 80%, and we are very confident we'll be finished before December the 8th. In October 2021, St. Lawrence County applied for $615,000 through the CDBG program in order to fund the fourth round of the county's countywide housing rehabilitation program, or CHIRP 4. CHIRP 4 was designed to assist low and moderate income households. The application was successful. In December 2021, the county was awarded $615,000. The grant agreement was signed effective December 9th. The agreements of 2021. The agreement stipulated that all funds must be expended within 24 months. That's December 8th this year. The agreement anticipated that 12 households would be assisted. The county estimated that all program funds plus all program delivery costs would provide a direct benefit to LMI households. This would exceed the 70% threshold for LMI benefit required by HUD. We calculate it's 95% direct benefit. The CDBG administration manual requires that, as I said earlier, one public hearing prior to submission of the application and one public hearing, if awarded, to be held during the administration of the grant to solicit comments on the effectiveness of the program and its administration. So I'm required to tell you that the following information. The amount of CDBG funds made available was, as I said, $615,000. This includes $505,200 for rehabilitation assistance. That's bricks and mortar. That's what we directly invest in people's houses. $79,050 for program delivery. That's what it costs our subrecipient to actually deliver the grant. And then $30,000 for administration. And our subrecipient takes the lion's share of that in county planning office. Makes a very small amount. I think it's $5,000. I'm supposed to give you a list of activities undertaken with CDBG funds. We have completed 7 units and we have 6 under construction. We had promised 12. It looks like we're going to get 13 done. So we're going to do more than 100% performance on this. Costs have ranged from $26,000 to $52,000. Average assistance was $38,800. The amount of CDBG funds made available for activities that benefit the LMI national objective. As I said, all program funds and program delivery funds directly benefit LMI households, and this represents a 95% direct benefit. If CDBG activities have resulted in displacement, review the displacement plan. There have been no displacement of households in the spring. Progress toward program goals and objectives. We had proposed completing 12 units, and we're on track to deliver 13 units. We are to provide and encourage citizen participation. That is the purpose of today's hearing. And we are to provide citizens with a reasonable opportunity to comment on the activities that were undertaken, or to comment on any activities that were added, deleted, or changed. And comments will be accepted until the end of this month, July 28th, to the planning office, to Jason Folkman, our planner. Finally, a little bit of CDBG history in St. Lawrence County. We've administered CDBG programs since 1982. All CDBG funded projects that benefit low or moderate income persons. We have obtained 24 grants to do home ownership assistance. These programs have enabled 625 low and moderate income households to purchase their first homes. We've also obtained 38 grants to rehabilitate substandard units. These programs have helped 658 low and moderate income households to improve their living conditions. The county's CDBG housing programs have assisted over 1,280 low and moderate income households. This equals approximately 3,100 LMI persons. These 1,280 houses improved total over 3% of all housing units occupied in the county. The planning office estimates the overall economic impact of these programs of over $97 million. Other communities in St. Lawrence County have successfully secured and administered CDBG funded housing programs on their own. These communities include the city of Ogdensburg, the villages of Governor, Messina, and Potsdam, and the towns of Fowler and Mapp. CDBG funds have also been used in St. Lawrence County for community planning projects, for water and sewer projects, for community centers, and for economic development projects. Are there any questions?
I'm curious. How did you come up with an estimated economic impact of 97 million?
Well, I have a whole worksheet that's full of formulas and everything else. Once upon a time, I worked for the Rural Services Institute at SUNY Potsdam, and they taught me how to do economic impact analysis. You can come on over and I'll show you the worksheet. I'll send it to you.
Just curious.
Right.
It's quite an impact.
Yes, sir. It is.
Any questions?
Yes, actually, we have. And I'm not entirely sure why. We've been running into problems with finding subcontractors. We think problems have developed during the COVID period. And we think we have all heard anecdotally that since people needed to stay home, they did a fair amount of looking around their home and saying, well, we need to improve this. So at the same time that COVID was telling people to stay home, the number of construction jobs and rehab jobs went up in the private market. That means that contractors have been less available to work on our project. In addition, lead abatement requirements have gotten more and more strict, and we have been required to add asbestos surveys and abatement. And that has made the jobs take longer, run slower, and there are some lead abatement contractors, there are very few asbestos contractors. So all of those conditions have slowed us down.
So the lack of labor.
Well, we're performing at over 100% on this particular grant. We promised 12, and we're going to deliver 13. The cost of materials has not been a big issue for us. The costs have gone up certainly, but from administering the program 3 years ago, the cost of a job was $30,000, and this year it's now $40,000. The people that run because of inflation and price of materials has gone up. The funders don't care. When we get a house, when we get a family that's accepted into the program, we are required to fix that house from soup to nuts, bring the whole thing into code. So they don't care what it costs. They want to know that it was. The bigger problem for us has been supply chain issue. If we're gonna put siding on a house, vinyl siding on a house, it might be 8 weeks before we ever get to the siding. Or window units, same sort of thing, 8-12 months before we get window units. Now that's easing up, but that has been an issue for the last 2-3 years.
You have your questions. Just. We think this is line to address. Time they address before they address. It's need.
You all,
Go anywhere. Line 17 versus approval of the agenda.
I Right.
To mention it. Sitting there, excuse me. First, we have users. The resolution is authorizing the chair to sign contracts, Medicaid, meds, behavioral health providers. Is rather than do nine.
Jay, we've discussed a lot about the financial aspects of providing the services. Do you anticipate improved results with these companies? Has there been talk about improving what we've discussed over and over in the past?
Well, each payer, for the most part, each payer likes to be billed somewhat differently from the others. So these contracts will lay that billing process out. It's clear for each. In terms of the rates, I mean, we probably running a little low on the amount of money we have in our budget for Epic contract. But we will be running these rate sheets by them to make sure that for getting a fair shake, so to speak. And negotiate. So yes, I.
Any other discussion? All in favor?
Aye.
Any opposed? Okay, our next resolution is authorizing the chair to sign a letter from Medicare as part of the credentialing process for the opioid treatment program. Have a motion, Mr. Burton, second, Mr. Burton, Mr. Burton.
All right, so we have the application prepared for Medicare for the OTP. So we're needing a letter signed by the board of legislator chair that going to make the county legally responsible to Medicare, CMS, Medicare, Medicaid. And we have contracts for the other clinics. So this is not new. I mean, the county is already bound for whatever reason that owes CMS. The county would be responsible. We just need a separate letter.
Any discussion? Mr. Forsyth.
Mr. Chair, Kate, what percentage would be on that? Really low.
I'd say 5 to 10%.
Any other comments? Discussion? Hearing none, all in favor?
Aye.
Any opposed? Okay. Our next resolution is authorizing the chair to sign a memorandum of understanding with Fort Drum Regional Health Planning Organization participating in a health resource services administration. Motion. By Mr.
So we are now a member of World Country IPA, which is have about 6,000 covered lives. It's the hospital system. Jefferson County, Claxton, Clifton Pond. And as a member of that, they're rolling out this initiative. Or it's called like whole health or population health. So when individuals go to the emergency room for a non-behavioral health, they're asking us to first they identify if they're one of our patients or ever have been. And so then we get a list. In June, we got a list of 18 individuals that went to the emergency room. Of those 18, only 2 of them are actually active clients still. But in any event, so it's not going to be huge volume, but our responsibility is to reach out to them by phone once we learn that they've gone to the emergency room. Then when they come in for a subsequent appointment, we try to connect them to medical providers that they need for whatever issue it was in the emergency. So the goal was to cut down emergency room admissions. So it's
Discussion. Hearing none, all in favor?
Aye.
Any opposed? Services update.
all right. So not a lot of remarkable change on this June update. The no shows and spoken someone else now. The clinic visit averages is about the same now a little bit. Although wasn't quite as strong this month, but certainly a pretty exemplary, especially when compared to society. If you look at the 2 charts, the bar charts on the left-hand side of the front page, the bottom 2, the visits per 7 hours actually went up 1%. Was 5.9 now it's 5. Was 5.8 now it's 5. But if you look at the bottom, it went down from last month. So to make sense of that, we went into the calendar, looked at their schedules. And this was the first month that changed the way we're scheduling eviction individuals. We met with each counselor and we came up with a matrix or a mix of what they needed in terms of how many 45-minute visits, 30-minute visits, 15 minutes. So we blocked that out to try to structure this a little bit. And what we found is, so this is part of the corrective action plan, is some people that were, say, had a 45-minute session still only met with the individual for 30 minutes. So we're going to have to try to correct that to try to get these numbers a little more up to par with. Subscriber visits, they went down a little bit. I mean, June and July are pretty tough months. A lot of people don't, the weather's nice, they feel better, they don't come to the but in any event, their numbers are about the same. So the wait list, the only people we have on the wait list are for the OTP right now. At the time, it was 5. And again, the OASIS definition of being on a wait list is we can't see them within a 5-day period. So it's not like these individuals don't have appointments, it's just not within 5 days. So that's the way we categorize this wait list. So it was 5, we're now down. There's no wait list for stalls. So, I mean, the percentage of dollars paid of billed services, not a whole lot of change there last month. The unsigned notes on the last page, this is actually a fluid chart. And what these mostly represent is notes that haven't been signed, so we can't send them out to billing. Once they are signed, we do go ahead and send those out. So that's why some of these percentages have changed from last month's percentage, because we did get those out. The OTP currently has, well, it was 169. Paying for in-house. So in terms of the billing process that we've been in, I'm fairly confident we've got it about 90% fixed in terms of the background and settings, things like that. Insurance is aligned. So our bills, our claims are dropping, meaning they're reaching, going through the clearinghouse, reaching the payers. And we're getting reimbursed. So for the month of June, we have a revenue of $257,016. Of that, $165,000 was for the OTP, which is twice or times 3 times what we were getting previously. It's good news, bad news, right? It's point.
Jay, I'm looking at the wait list, and we've had concerns about that before in the past for about a year now, particularly in regards to mental health. And to your knowledge, how do you explain it going down to 0? Are people that were waiting getting served someplace else, or what's responsible for this going down to 0? I mean, that's rather remarkable.
Well, we were actually able to bring on another mental health.
Okay.
So that us wanted to straighten that in. Caseload for extremely tall, heavy. Paper metal. So we're trying to reach that.
That's great.
We still have 2 vacant positions, supervising social worker and a counselor position. Side. But I mean, we've had these vacancies well over. This is the answer. That's-
Good to hear.
Correct.
Also, Dave, we noticed, like, if I did my clinical, that in the summertime, when people get probably the proper amount of vitamin D, sunshine, and nice weather, new intakes just fall down, they fall off until the weather gets better.
Any other discussion? We have a resolution from. So this resolution is proclaiming August as National Immunization Awareness Month.
So, every August, we like to, bring it as National Immunization Month to bring awareness to. We are also going to be restarting up our travel clinic that we have not had since 2009.
Discussion on this. Let's see the travel immunization. Being restarted. Planning and. Immunization.
Yeah.
So that's a.
We'll be bringing that.
All in favor?
Aye.
Any opposed? Next, we have our vacancy review committee as well.
So vacancy review is a little congested on this agenda. I appreciate your willingness to serve both operations and services this month. With the July holiday happening on a Tuesday, which is typically our vacancy review committee day, we delayed that to the 11th, which was last week, and so we missed the operations committee opportunity. So you'll see on this agenda both operations and services committee. There are 3 departments to be represented tonight. And 4 under services. I'll be presenting for both our Office for the Aging and for Social Services, as our senior staff have other obligations this evening. Just to give you a quick rundown on the statistics, first is a reminder that next month I'll provide you with the annual report that I provide with an update on the statistics as well as any recommendation. Our vacancy rate for June was 8.7%, a little bit higher. Typically, we're in the 7.5 range. Our fill rate for immediate fills was 96% in the prior month. And we are a combined between the 30-day, 60-day, and 90-day request for fill, a combined rate of 1.95% or evenly distributed 0.65% each. That is almost identical at 1.96% of the held or withdrawn positions. So the majority of the positions coming before you are filled and are filled with immediate authorization. For 2023, I also like to keep you informed with the board's latitude provided to me of the temporary positions, the positions filled in a probationary standpoint, and the part-time positions. And to date, that is 57. And the breakdown is 20 temporary positions, 36 probationary filled positions, and 1 part-time. So those 57 positions may have been delayed or otherwise caused the department to be behind in the work they need to complete if the boards hadn't provided the opportunity to fill those positions. We're getting better about closing out those positions. They have very specific rules about how long they can be filled and who they can be filled by. One of the things as we started this out, when those dates of 3 months or 6 months expired, we weren't going back and abolishing those positions. So as we've learned in looking at budget since that time, we've gotten much better so that when we look at FTE counts, they're representative of the positions that are authorized to be filled. So that being said, the first up in front of you this evening is public defender. James?
Good evening, everyone. This is the position I discussed, probably last time I was in front of you about a position about the resignation associated with the raise. This position in particular is a assistant public defender position covered. Majority of the salary is covered by the upstate caseload relief grant. This is the 4th iteration of that. We actually just got awarded $300,000 over the course of the next 3 years. So this grant is still going. This position can be used for both family and historically used it.
Questions for James? And in the near future, you'll see a contract request for the 4th iteration of upstate case.
Yeah, it just has to go through the process. We have to send our proposal at last. Idea.
Good news, keeps an attorney employed, hopefully. Thank you, James. Next up, I believe Under Sheriff O'Brien is with us virtually for 2 positions. Go ahead, Under Sheriff.
Good evening. The first position is for a corrections officer. This is a backfill from a promotion to a corporal position. It was determined that 62 full-time officers are required to help minimize overtime and carry out the rules and regulations that we have at the correctional facility.
Questions for Sean on the correctional? Okay, next one.
The second position is a deputy sheriff position on the road patrol. This was a vacancy that was that happened because of a lateral transfer to a downstate sheriff's office due to a family issue. So this would be a deputy sheriff position on the road patrol, assisting in the pistol permit process, the transports, and all the other criminal division duties that need to be taken care of.
Questions on the deputy? Okay, sounds good. Thank you, Sean.
Thank you.
And last under operations tonight is our county clerk with the request to fill a motor vehicle clerk position.
So I'm requesting to fill a DMV clerk position. We had one person resign for a state job with better pay. Since I met with the vacancy committee, I have now had a second vacancy and one long-term workers' comp person now. I'm very.
Questions for Sandy? Okay, thank you. And then moving on, the first position before you under the services committee vacancy is a clerk in social services. This position, as Commissioner shared with us in vacancy review committee, supports the entire unit of child support. They provide support involved with mail runs, copying, all of the basic functions that provide our support investigators with the ability to complete their tasks on a daily basis. So the request for this is also an immediate fill. Questions? Okay. Next up, I'll also be talking with you about the Office for the Aging this evening. And this is a little bit of an unusual request. These are traditionally our temporary positions that our Office for the Aging Director is requesting be considered for part-time. So you'll remember not that long ago, we took very seriously the grade 7 wage with respect to the change in our minimum wage. And while the county is not required to honor minimum wage standards, we also yield the result, benefits and disadvantages of not moving ahead with minimum wage. And so the board took action and now has moved that wage at least on par with what minimum wage is in our region. Beyond that is the competition in this arena of work. And just to add a little bit of color to the challenges facing Office for the Aging, There's been rapid growth. I think you're familiar with almost doubling in home delivered meal requests since 2020. Also changes in SNAP benefits ending from an emergency standpoint associated with COVID. Individuals, seniors who've been receiving between $200 and $300 per month, in some cases now only receive $25 to $50 per month. And so that's caused them, I think, to also look at other options available to them, this being one of them. And that's increased the request and put the need forward. That being said, changes being able to employ folks, they're receiving approximately 15 new referrals per week. And that's a real challenge when currently they have one nutrition aid position filled. They rely on the nutrition assistant to prepare and supervise the site to get the meals out the door and the aides to assist in making that happen. So this request is to take all the positions that we have in a temporary capacity and to move them to part-time. And hoping that even though the wage won't change with the action the board's just taken, that wage stays the same, but now we'll also offer benefits. That we may be able to attract a group of individuals interested in working potentially for benefits, but with the competition in the field, that may not always be a part of the other opportunities that are presented to them. So they are limited to 30 hours per week, and the 6 months at a time was also a challenge for the nutrition aides. They believe they're also going to have 2 nutrition assistants, which again are the supervisors at those sites, retiring within 6 months. So that again will compress their ability to meet the needs. There's an expansion opportunity, but with lack of staff, not only the board granting positions to the department, but then the department being able to fill them. And so Andrea and I have met and discussed this for a long period of time now. We believe it's time to bring this forward for consideration to move these into a part-time capacity. Questions? Okay, thank you. Next up, we have Jay coming back to join us for an abolish and create request. Yeah.
So, this request is to abolish, an account clerk, creating a medical billing. Currently in our budget, we already converted the account clerk. In the budget, we have one medical biller. We're asking a second account clerk. Just in I there's a huge difference in the skill level of a medical biller versus an account clerk when it comes to actually billing payers and insurances. So, open to get this converted to
Questions for Jay?
we have 2 vacant account clerks right now, yes.
Other questions? Okay. And last under this agenda for vacancies is public health with a request to fill a medical consultant.
Our medical consultant position, we are required to have a function, and they sign all of our standing orders. They review medical charts. They have to sign off on all of our new hire and annual health assessments for staff. They're available for consultations, for questions when we have them. Any concerns needed, and they're also a member of our quarterly quality improvement committee. And all of our purchase of medications and vaccinations are underneath their license.
Thank you, Mr. Chair. How long was Dr. Como? It was Dr. Como, right?
Yes,
How long was he with?
he's joined us March 29th, 2016.
Okay. For $10.98 an hour.
Well, we just increased him last year to that. We doubled it. It was $5,000 per year. Had to-
There you go. All right, thank you.
Any other questions? We do, yes. Any questions? Thank you, Jolene. Next, the vacancy. Few updates. Packet. I wanted to remind you that we have changed with the board's obliging the fair visit once again this year on July 31st. There'll be no meeting next week, so you have a Monday free. And then we'll hold finance committee at 85 East Kearney Street, Governor, to kick off essentially on the grandstand of the Governor and St. Lawrence County Fair. So we'll hold finance committee meeting there. I wanted to mention all of you have received either email communication or print mail with regards to the NISAC Fall Conference that's being held September 13th through the 15th in Oneida County at the Turning Stone. We are already in place for those who haven't indicated an interest in going. We're booking at the alternative hotels. It seems as though they're getting a great turnout already. So if you're interested, we have 2 legislators already attending. Let us know as soon as possible. We'll make sure that we get reservations made for you to do that. And this is a little different. It's a Wednesday, Thursday, Friday. So traditionally they're Sunday to Wednesday. So if that works for your schedule, let us know. I want to make mention, and certainly IT staff could give more information than I, but we did have some email communication issues last Friday. We were completing the transition from the .org to the .gov. With the transition of the access available to you through the internet, which is called OWA for us, there was a glitch that forced a little bit of email communication issues. So hopefully, either you've had a chance to meet with and talk with our IT staff who are here on hand, but to make sure you're back online and able to get email before you depart this evening. Last week, county officials met with the city of Ogdensburg to chart the course for the transition of collection of taxes from a timeline perspective, but as well as discuss the notice and foreclosure process as it will be changing. The meeting went well, and there's some determinations that remain outstanding, but will help us proceed forward. The treasurer and her staff are going to continue working with the fiscal staff in the city to come to some information sharing that will allow us to move forward. I want to bring it to your attention tonight an issue that I'm hopeful the chair will oblige and appoint a small committee. Last year, you may recall some attention spent looking at the distance that our funeral directors have been driving for pathology services. We've been going to Broome County, Monroe County. For many, many years, we've been going to Albany County, but all of the expenses associated with that transport have increased. And so the board took action at our recommendation and increased the cost for funeral directors that are reimbursable. The balance of that is another area that we don't often have the opportunity to talk about, but that is the indigent burials. And that the rates for those have not changed since 2013. And so likewise, an opportunity to take a look at these, to have a committee put together that includes some representation from the Funeral Directors Association, also from Public Health, and certainly not leaving out our coroners in the discussion, but figuring out what that indigent rate should look like. There's a number of them. I'll share the resolution from 2013. You can take a look at it. But if the board is in agreement and the chair will oblige a small committee to bring forward a recommendation for rate change, would be appreciated as well. And then the last item I have before we get into the information is this Wednesday, July 19th from 10:30 to 12. There's a virtual forum that's going to be held to inform so that we all better understand the Connect All initiative. And as a reminder, Connect All is Governor Hochul's initiative to bring reliable, affordable, high-speed internet service to all New Yorkers. If you're interested in attending that forum, or even if you want to have it playing in the background so you can get some updated information, I'm happy to share that with you and make sure it's available. Any questions for me before I go into the information you've been provided? Okay. So with Commissioner away at training and most of the folks who would present in his absence, I offered to share with you the social services, the first iteration of the financials. And in this information you received, it is, for all practical purposes, a 20,000 foot view. And as we start with budget, we also thought this is an opportune time to begin to increase your knowledge, but also to avail you the opportunity to ask for more drilled down data. So we have, at least initially, completed this in 3 pages. We'd like to have it 2, but certainly can expand to include any and all information you'd like. The first page really takes an equal perspective of percentage of budget, which really, regardless of the actual number, tells you where the department is compared to years past. But then it also takes the dollar amount on the right-hand top column of the existing adopted budget, and it tells you where we stand today versus 3 prior years. So you can start to wrap your mind around a little bit where we fit amongst our prior year expenses. And then we start to break down a little bit of the appropriations and the revenue. There's always a question about how much New York State owes us. That's not included here, but what it does break down is federal, state, and local revenue on the second chart on the right-hand column. You'll also see just the breakdown of appropriations versus revenue, and we'll keep that running on a quarterly basis so that you can start to track and recognize if we're seeing costs, either revenue not coming in or appropriations starting to spike. And then we get into some actuals by category. Now, with the budget years behind you and those who are new, you'll become more familiar with our subject areas. Our 100s are our personnel, our 200s are our equipment, our 400s are all the services and contracts we have in place, 500s are our revenue, and 800s are our benefits. And so the bottom column on the first page breaks that down for you, so you can see where our spends are by category. That's just appropriations. And across from that, you can also start to see the 4 main categories the department takes care of: administration, temporary assistance or eligibility, Medicaid, broken out because it's so extraordinarily different, and then services. And that's your adult protective, children's services, everything. In those 4 areas, you can see the breakdown, and Medicaid leaves them all far behind. And then on the following 2 pages, you get a summary chart, which again demonstrates to you how far above the spend on general programs that we make on Medicaid. So you can see the 9.7 spent on Medicaid so far this year as of June 30th. And then you see just basically a block, right? So then we take the next 4 charts and we pull them apart. So if there's a program you're familiar with or a program you're interested in, you can look at those subunit charts, of which there are 4, and you can see which area and what the spend is so far this year. Again, just appropriations at this point. When we get a finance director in place, our hope is they're going to be able to break down for you not only how much revenue is coming in against each program, but that age-old question about percentages against positions. We haven't looked at that in a long time, and I believe that's going to be one of their first tasks, is to come in and understand that process, but also become accountable in whether or not we need to adjust that number in the vacancies you see every month. And the last item, because it's occupied some of the discussions and the interest in the foster care setup, are the institutional costs. And those are when children are placed in institution, not the institution of county government. So that is the beginning of what we hope to be a very informative piece of information for you. If, as you look at this, other questions are prompted, please send them along. We'll be making this same presentation to you again at the end of the 3rd quarter in October. So this will track the same reports you get on the finances at the close of every quarter that month following. So next week, for example, you'll see the 2nd quarter for the rest of the county. We thought it would be quite timely to bring you the social services finances the week before. Any questions?
That's not.
That's placement in a facility, yes, and the tuition, things of that nature. Any other questions? Okay. So then the other piece of information provided to you is the recommendations for reserve allocations and the fund balance policy. Now, it seems as though for a variety of reasons, most of our reports to you are coming just a little bit off schedule. So the unaudited financials typically come to you at May finance. They came to you June operations this year. I was away for June finance, and that's typically when I would present you with this. And that's also what prompted a change to circulate the information a little bit ahead of time to figure out where we want to land. So what you have before you is the first part of reserves recommendation. This is the 4th year that you're seeing reserves recommended and 1 new reserve requested. So the totals will include an additional 2.5 million for capital, 4.6 for health insurance, 300,000 for the new sheriff's vehicle reserve just created last year, 200,000 for the blighted foreclosure residential properties that was just started last year, and then a 10-year contribution to the ENRS, which is the environmental reserve that assists us in all the work the county attorney's office, the treasurer's office, and Gary Bowich does to clean up commercial properties to get them back on the rolls. As you know, our revenue source has changed associated with the revenue coming in against properties we're able to return to the tax rolls. So in doing so, we took a careful look at how we might better invest so that these programs don't die because there's not revenue supporting them. And so in this recommendation, you typically wouldn't see me requesting the ENRS funds out of the prior year's performance. But this year, in talking with the treasurer and the county attorney, they both felt it important to start early to identify a new revenue source. And so typically, they'll appropriate $50,000 annually to assist in the properties that you approved going through for phase 2s, for the testing, for the work that needs to be done to get those out of layman's situation, to get them back on the tax rolls. This funds it for 10 years, provides a one-shot influx to continue that program. For a total, out of the $11 million of 8.1 million. And then it also requests a new reserve, another capital reserve, but this time rather than for facilities, to make one for equipment. And you may all recall that in 2016, a bond was taken in the amount of $3 million to begin catching up the investment in our highway equipment, which has required an annual payment to pay off that financing. The capital reserve for equipment begins for the first time a pre-fund of a cost that we know will be coming. Our highway superintendent for 2 years has been requesting in 26, but now he's actually moved it back to 25, an additional financing opportunity to continue replacing equipment. And in my effort to avoid financing, a pre-funded reserve would be very helpful in that endeavor. There's no question the equipment needs to be replaced. This is a way to do it with our own money rather than financing and paying interest. So that's a request for a new reserve, coming to a total of $9.1 million. That leaves a balance of 1.9 of the 11, which I always qualify subject to the auditor's adjustment. With that 1.9, in my recommendations, there are 3. The first is that the board follow its own lead from last year and invest in an additional 10 miles of highway this year. So last year, our highway superintendent was able to add on to projects in areas where both supply chain, funding, and opportunity weren't going to allow, and to pave an additional 10 miles. This year, my recommendation is to do the same thing once again. To add that, to have the conversation of finance and have the board approve while we have contracts in place, while we have contractors out on projects, to expand the footprint that was originally anticipated when the 2023 budget was put together. The second recommendation is to pay off the equipment bond I just referenced, with its outstanding just under 1.4 million. And I'll speak to that again in a moment. But the interest in finishing that, to not have to have the budget allocation set aside every year until what I believe is 2031 now, also to avoid the interest. I'll come back to that in a moment. My last recommendation is to set up that reserve in the amount of $1 million to pre-fund the purchase of equipment. So going back for a moment to the highway bond, in reviewing this opportunity and this recommendation, which stands, the treasurer advises that currently that amount of funds through New York class, we're able to make 5% on the funds that we have. And so thinking carefully, what I would ask is that the board take the recommendation to pay off the bond, but to allow us to work through when that occurs. And so both to make as much interest as we can on the funds that we have, but also when we see interest rates start to change, that we're able to pay that off because it's callable now. That sound reasonable to the group?
Thank you, Mr. Chair. And it's at 2%
Yes, it is.
right now, and we're making
As much as 5.
as much as 5.
Okay, so those,
The bond is at 2%.
correct, interest. Okay. And so the,
Mr. Ray.
Just, I don't know if you know the answer or whether, wait till Don's here. How many years does, when you pave a road, how many years does it last?
well, I believe the standard, and I can verify this, through down for the CHIPS function. And I believe there's much greater expectation if you take just the fact that we plan to pave between 28 and 32 miles a year. We have almost 600 miles of road. So just the odds of those in the math, we expect them to last 30 years, but we know they don't. And so we're continuously chasing that 30 miles every year, but I can confirm that for you. What the expectation is.
I think that the idea of spending some of this money to add an additional 10 miles of road is an excellent idea because, based on the current system, with 573 miles and 28 to 32 miles of road, that's once every 20 years. And if the roads are only lasting for 10 years, there's a huge gap.
Perfect.
So get CHIPS funding every 10.
We get CHIPS funding every year, but I believe the standard is the road has to last 10 before we can use CHIPS money on it again. Not
So-
confirm that. No, I asked specifically for it not to impact. And also to touch different areas than were used last year as well. So I believe that we'll have an update on that for next time. Okay. And then the last portion of the recommendations goes to the fund balance policy. Since its inception, we're at the 6th year where we have been setting aside funds, and the chart is updated on the documentation for you. Again, subject to the auditor's adjustment. But in the budget, I have thought very carefully with the budget team about how we reduce the impact on the local taxpayer. And the way that we've done that is using some of the appropriations on the levy, but also using the result. And so that's what we've done every single year to be successful in how we meet the 1% required by the policy. So what we do is we go through the budget, we figure out what the budget can absorb. And each year, as fund balance has grown, you can see on the chart, we've reduced what we're setting aside. And so in that way, the recommendation included here for the 2024 budget is to continue to appropriate to fund balance, but also to look at those reserves and where we may start to use those reserves and to fund those instead of a direct fund for the general fund. Because as we see, as you'll see certainly once the auditor's results are complete, but as you heard in the unaudited results, our fiscal health is dramatically improved and continues to do so. So in that way, the board has been generous in providing me the opportunity throughout the budget process each year to come back and revisit that discussion. If we're in a situation looking at both the change in the NREM and the effect on the treasurer's budget, as well as the change in the EF map that we know is going to be close to $1 million for next year, we may have to have a different conversation because we don't know what that's going to look like. We're working on budget now, looking at both projections and what the requests will be for next year. But the board has been very generous in allowing me to come back if needed. Any questions?
This is a very. That's the hazard tree. Trees. No, that's a lot. But I'm. Looking. And I know. But I guess. You. Thank you.
Two things with that. One, we're in the transition, I think, as you are well aware, our conservation district manager. But our forester is still very active on the Emerald Ash. One of the things that I put in this year's budget, in 23's budget, is a couple $100,000 to continue that work. Now, if the board wanted, depending on the transition, the reappropriation of those funds can occur for hazard trees. I'm hopeful to meet with the head of the budget, the new manager, to go over that, to see where they are. I know there's a moratorium on cutting trees now associated with some wildlife, but certainly something we can discuss. And if Steve wants to speak to liability associated with hazard trees, the chair could recognize.
You being summertime?
More than that. It has been well established now since back in English period. You're talking about 14. Land no compared to that would include felling trees that you were looking at trees on the that they're not within within a paid portion of fee simple for the roadway itself. Then the landowner that's adjacent to the roadway in which the tree actually exists on that tree. Now, we have a significant number of county lots throughout the state. On those lots, where there are trees that are adjacent to the roadway and they look like they are failed, we are responsible. However, where you see a tree and it is not on county property.
As follows. The right of way. 30 feet. That road.
Statutorily, it's 25 feet.
Trees, all
They actually exist from the root structure, and the root structure would exist outside that 25. But let's assume, just hypothetically, that you're looking at a situation where you have the roadway right, meaning the road exists on right of way, but the underlying land is in fact owned by the adjacent. Let's assume hypothetically that a tree is in that adjacent land, still falling within that sort of right of way area, but it's on the land of another. If it actually existed, I'm talking about the stump itself, the trunk, and the limbs. If it in fact existed within the right of way, we are responsible. Outside of the right of way, while on the land, to the roadway, that becomes the responsibility. It's not simply enough that the lid itself extends into the right of way, with the root structure underneath extends to the right of way. The tree trunk and stump also has to be within that area of community control for the county. to be responsible.
boom. And.
There is, actually, under the highway law, we have the means to actually ask for a landowner to clear any shrubberies, brush, anything that constitutes obstruction even if it falls outside of that 25 feet from the center line. If it falls within a drainage or a ditch or within a swale area, we can ask that they remove. We have control over those areas that are in fact adjacent to allow for the flow of the roadways. The expected savings to the taxpayer on interest rates and saving, and you mentioned the differential bond and making and market. They're just for each of those items, I don't want to add analysis where you maybe haven't. So I'm just curious to know if we try to articulate what that savings means.
So probably not wholly, but any that I don't have, I certainly can get. The interest, as the treasurer shared with me, that will be paid on the bond I've been referring to between now and full payment in 2031 is $103,006.26. The interest potentially that could be gained by holding off on paying off the just shy of 4 million or 1.4 million is approximately 42,000 that could potentially be made through February of next year. Depending on what rates do, that's also why it's a little bit suspect on much further out projections. I think that pausing until it looks less favorable to the county makes a lot of sense. Good. And that concludes the administrator's report.
Next, move on to committee reports. Board of Health, Mr. Curry.
Thank you, Mr. Chair. So the last Board of Health meeting was June 20th. We talked about the lead progress that we've made. I don't have the formal minutes yet. We talked about lead. We talked about the increase in tick-borne illness, the different things we're seeing that we had not seen before, and why we think, even though we believe clinically the numbers are up, we're not seeing the reports to the state or coming back to the county, because many providers will be like, oh, look at that bullseye on your arm. It's got the only thing that does that is a tick. We're going to treat you. So people are treated but not necessarily tested. We used to have a CLIA waived test that could be done in any laboratory. CLIA is a federal government regulation agency on testing, like any test, anything that's done in the lab. So because of the changes to CLIA, they can only be done now at a reference laboratory. So they're send outs and they take days, and many times people won't run them because you're here in my urgent care. I think that's Lyme disease. I'm not going to track you down 7 days later. So that's why we think we have less than what's probably out there, but the numbers were up. And then we discussed as a group education on marijuana, because if you read anything at all from any pediatric association, we know that marijuana is really bad for the formation of the frontal lobe and people basically under 25. We talked about the fact that there's just a barrage of billboards and hot shops and all the other things that are out there, but we're not seeing any really great education. The state did put out a very mildly worded kind of like, well, if you think about it, maybe marijuana is not good kind of thing that you saw. And our Board of Health put that out too. But I really think that there's a lot of research that could be done. And when we come back and go back to regular meetings in September, you'll probably see us
try to put forth something that's a little bit more strongly worded. I mean, there's really good research that aligns increased schizophrenia in male people. When they use a lot of marijuana, we see a huge increase in anxiety, cyclic vomiting syndrome. 33% of all ER visits are from abdominal pain. I probably think that in many groups, about half of that is cyclic vomiting from marijuana withdrawal.
Ms. Carter, are you implying that just because something was legal, it's advisable?
I think I'm saying that because it is legalized at this juncture, does not mean I would recommend it to anyone. I just think that it's, I think there's many, we don't have, you know, like when they put out a new pharmaceutical, you have about 10 years worth of data before I can prescribe it to somebody. We don't have data. We've never collected great data on marijuana and what it does to you. We sort of know from watching things, Joe could tell you as a police officer, drugs don't go well with you. But we've never sat down to study it. I think that they wanted to make sure it was decriminalized. Maybe somebody thought it would be a great idea to legalize it, but it so far has been a really a not good thing for children. And the number of people that I see in the ER secondarily to it, and now that people are adding all sorts of unknown additives to it that people don't realize they're getting, it's generally a bad idea.
Do you know if there are statistics available for underage exposures to marijuana? Anything, is there anything available?
There are, and I think you and I had discussed the fact that when I got done with this last class I was taking, I was sort of gonna get into some statistical compilation on that, just because it's staggering. The things that happen to children, you know, doing it, everything from palpitation, they report anxiety, they're going to see doctors they wouldn't have to go see, they're ending up in emergency rooms they wouldn't have to be in. So we discussed that and basically said that we would also try to get additional dates this year for walk with a dog.
Next report, Mr. Burke, CDP Board of Directors.
The big news is neighborhood centers. People distress because of the lack of donations, especially through. This has been going on a while. It's really weatherization money has been received. They're in and Head Start is actively recruiting children for that school year. And they don't meet during PDP next week.
Mr. Webster. You have to make your mic.
You said can't is a distraction. Why is that a distraction? Because of outages? I don't know. I asked our madam. What might. She thought that Canton has the church community worker. So, yeah, you would know more. But it's like they do a lot of the same things. I don't know that CDP actually knows for sure what's the cause, other than the fact that it could be the
Move on to
There, but I can report from the course. Report, but I do want to remind everyone that the seniorama this Monday. A lot of seniors. And the other thing I want to put in. We've spoken before. Aging. You know. Section of it. Entirely. So please. Please.
So our teen interns started last week, and there are 5 in the youth bureau, 1 in the conflict defender's office, 1 in the public defender's office, 1 in highway. We anticipate receiving the announcement of the new allocated funds from the OCFS for the youth sports teams programs coming later this year. And our next meeting is August 1st at 9:30. And I just wanted to share that Alexa's husband and Scott from the 10 months of deployment. So we're excited to have him back and thankful for his service.
Is there any old business? Is there any new business? Under new business, I'll invite Ms. Munger up. She's still present in the wings to share a new report that she has from public health.
Thank you. Board that outlines some of the current for those that identify themselves as the LGBTQIA. So
Sure. Yeah.
so I'll just go through some of the main definitions, and this was available for anybody who would like it. But so the LGBTQ plus population is an acronym for the lesbian, gay, bisexual, transgender, and queer or questioning. The terms are among several that are used to describe a person's sexual orientation or gender identity, and the terminology continues to become more inclusive and culturally responsive. So within that, some of the terms, like the majority of the terms are lesbian, who is a woman who is emotionally, romantically, or sexually attracted to other women. A woman and non-binary people may use this term to describe themselves. Gay is the adjective that describes people who enduring physical, romantic, and or emotional attractions are to people of the same sex. Bisexual is a person who emotionally, romantically, or sexually attracted to more than one gender, though not necessarily simultaneously. Transgender is an umbrella term for people whose gender identity and or expression is different from cultural expectations based on the sex they were assigned at birth. Yes, so within demographic statistics for our county, in 2022, we do a community health assessment in conjunction with Jefferson, Lewis, and Mark County as part of our community health improvement plan. We're required to do one every 3 years. In this past year, some of the questions did include questions that were related towards this population. So within our county, it is a small sample size, so we have approximately 107,000 individuals in our county, and out of that, only 535 individuals responded to our survey. And this is a survey that we use to inform a lot of our decisions. So when we do this again, it's always nice to get more people to do surveys, but we always struggle to get people to participate in any kind of survey. So out of that 535, which is 0.5% of the county population, 3.3% of our sample identified as part of the LGBTQIA population. So the data that I have either comes from that survey or from a survey that New York State did in 2021 to identify data. So within New York State, based on that survey, 18 and up, so in our survey as well as 18 and older, 7.9% of the state identifies as part of the LGBTQ plus population. So some of the public health factors that are unique to this population are socioeconomic. So they are significantly more likely to be living in poverty than their straight and cisgender counterparts. And overall, more than 1 in 5 LGBTQ adults, 22%, are living in poverty compared to an estimated 16% of their straight and cisgender counterparts. LGBTQ plus workers typically earn about 90 cents for every dollar that the typical worker earns. And LGBTQ plus people of color, transgender women, and men and non-binary individuals earn even less when compared to the typical worker. For their mental health, with our study that we found, they're more likely to say that they have less than good mental health. And 29% have said that they have experienced challenges or difficulties in receiving behavioral and mental health services locally in the past 12 months, and this was in 2022. And only 31% rated their mental health as excellent or very good, and that was the least commonly rated for that group. One of the most notable subgroup analysis results that emerged throughout the North Country in 2022 are that they were reporting to have been diagnosed with mental health condition as most common among this group. 39% of the subgroup report a diagnosis with a mental health condition. So within healthcare, per our survey, only 55% had visited primary care within the last year. And within that, so it was 39% of the subgroup did report, which was part of the highest, that they would be willing to take a course or teach a class or take a course or a class to teach them how to manage or prevent problems. Only typically for the non-LGBTQ plus population, that was only 25% for the rest of it. Some of the indicators of healthcare access limitations, such as having no healthcare provider and having no health insurance, are experienced at higher rates among the LGBTQ plus adult population in comparison to the state's overall population. They are more likely to report not having a regular healthcare provider, 24.4% of LGBTQ adults and 27.5% of transgender adults, compared to the general adult population, which is only 20.5%. The same for them not likely to have health insurance. The LGBTQ are about 14.3% and transgender 18.9% for not having health insurance versus the general population at 12.3%. The other big one is that for the occurrence of mental health conditions, that's more common. An estimated 12.3% of adults report frequent mental distress. The rate of the LGBTQ plus adults is double at 24.8% and even higher at 30% amongst transgender adults. So overall, over 31% of LGBTQ plus adults and 37.8% of transgender adults have reported a diagnosis of a depressive disorder, compared with only 16% of the New York population. So some of the initiatives that the state is doing to help benefit this population, they have developed in the early 2000s an LGBTQ or LGBT Health and Human Services initiative, which aims to eliminate disparities in healthcare access by increasing the availability of quality healthcare services and support for underserved populations. In 2010, a formal work group was established to examine scientific literature on LGBTQ health. And the New York State Education Department has committed just recently to providing all public school students, including transgender and gender expansive students, with an environment free from discrimination and harassment. There are some resources that are available to our population. Within our county, we have Planned Parenthood, ACR Health, AHI, the Advocate Health Institute, our colleges and universities, and then the Northern Regional Center for Independent Living. And then also for education, for public school students, we have North Country Prism, the ACR Health and the Q Center, and then the New York State Education Department. And then for unique medical services, we have Planned Parenthood, ACR Health, and Community Health Center of the North Country. So some of the ways that we could better serve the people of St. Lawrence County in this area in regards to public health could be to reduce stigma. So stigma and discrimination against the sexual and gender minorities can lead to chronic stress and cause stress responses, high blood pressure, anxiety, depression that accrue over time, which eventually lead to poor mental and physical health. And part of that too goes from the fear of discrimination in the healthcare setting and lack of providers that can provide affirming care. And for education and awareness, behavioral health providers, parents, schools, policymakers, and communities can best provide support to children, adolescents, families, caregivers, and improve their behavioral health when they have access to the most current information about sexual orientation, gender identity, and gender expression. So despite recent advances in equality, the LGBTQ plus families and individuals across the country continue to experience discrimination across their lives, including at work. According to an October 2020 study, 36% of LGBTQ plus adults experienced discrimination in the workplace within the last year.
A lot of content. Is there any initial discussion? Webster?
There was a lot of information. I might have missed it, but just out of curiosity,
Your mics.
was there any statistics on the drug-related problems with the LGBTQ?
Plus, no,
I knew I was missing a letter.
well, so it just depends on what acronym you use. There's the shorter one is LGBTQ plus. There you can go into others, but I do not have. So our survey itself did not go into drugs because with ours we have to. It's not just about. It's a whole lot like community wide survey. So my survey didn't have that, and I don't believe the state survey did as well. But
Would they not want to know that? Well, that seems like that could be important.
it would be, so the way to, so when you create a survey for people to answer, you have to take a look at what you're trying to get for your answers first. And then you start with a lot of questions and you have to pare it down to make it a manageable survey. These surveys still are about 100 and some questions. And to get people to answer that, it just goes to what overall is the direction of the survey that you want to go in. So with our survey, we do meet as a group between the 3 counties and all of the our partners that use the survey to try to determine what they are and what they've been aligned with in the past, and what we're trying to get data at for the next year. So it's not to say that we put in, it just hasn't been included in our survey.
Could you email all us a copy of that?
Of my report?
Yes.
Yes.
Please.
I can also, our community health assessment, well, at least our community health improvement plan is on our website as well. For that, but yes, I can email everybody. I'll send it to.
Thank you.
Ms. Curran.
So you were mentioning Planned Parenthood. What are some of the services that Planned Parenthood provides?
So we generally see a higher rate of STDs and in this population. So that's one of the services that they do provide. But they provide a more safe environment too for the people of this community to seek care. They have that affirming from the affirming providers there. Some Planned Parenthoods do provide care for transgender individuals as well.
And does that start at any particular age group? Do you know what they're?
I do not. And I know every Planned Parenthood is a little bit different.
Thank you.
You just mentioned the provision of gender affirmative care.
Well, it's affirming treatment. So like when you go into the provider to have your views and why you're there,
And does that have to do with the sort of disposition of the provider? Does that have to do with the actual treatment being provided to the patient?
It's more of a disposition of the provider.
Okay. Are there particular types of treatment that are sought or more frequent among this population that would be relevant from a public health perspective?
So one of them, like we provide the mpox vaccination. The target population for that is men who have sex with men. But it is available to anybody else, but that is our target population for that. But a lot of services are going to be similar services, unless an individual is going through a changing their gender.
So a person who's coming in, identifying themselves as they're trans-identifying, they're seeking care to do that. So for example, like hormone therapy,
Right.
puberty suppressant, medication, hormones, those sorts of things.
Those would be different services.
Okay. What's the availability of that? You might not know that. I'm just wondering, in our region, what's the availability of that? One more question. Thank you for putting this together. It's a lot of, I know it's a lot of footwork, it's a lot of numbers, but it's important. It really is something we want to be attuned to and responsive to real needs in the community. Obviously, one of the first steps in responding to a public health need is defining the population, the demographic, understanding who it is, right? And it's not always a perfectly defined group, as we know in many different areas. One of my questions with this topic is the plus at the end of the acronym. What does that constitute? What's included in the plus? And I know we don't have to take too much time. I'm just wondering from a formal standpoint, as we're responding to a public health need, I think it's important to be able to define that rapidly.
So the plus can stand for, it can be like, so once you get into the longer, so queer can be used for a catch-all to include a lot of people. It could also stand for questioning, so people who are used to exploring their sexual identity. Intersex, so the plus be intersex for people who are born with a variety of differences in their sex traits, reproductive anatomy. Asexual refers to a complete or partial lack of sexual attraction or lack of interest in sexual activity with others. Ally term that can be used to describe somebody that is or non-binary, is somebody who does not identify exclusively as a man or a woman. So that's what the plus can include.
Did you mention the cisgender term in the list?
I did, but I must have printed off an older copy because I see some of my old notes on here, but I do have cisgender.
And is that included in the
plus?
The plus as well?
Yes.
Okay. You know what's not included in the plus?
I think anything really left would be included.
Any other discussion? Thank you. Ms. Royals, we need to enter executive session.
There is for litigation, negotiations, and personnel, which is the medical, financial, credit, or employment history of a particular person or corporation, or matters relating to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation.
And motion. First and second by Mr. Smith. All in favor?